Do you feel lower back pain almost every day after turning 50? What if it's not just aging, but a deeper problem? If this video is helpful for you, don't forget to like it. Today we are talking about lower back pain after 50 and whether it is caused by muscle loss or nerve damage. Many men think back pain is normal with age, but not all back pain is the same, and understanding the cause is very important. After 50, your body naturally loses muscle mass. This process is called sarcopenia. When the muscles around your spine become weaker, they cannot support your back properly. As a result, pressure increases on your joints and discs. This type of pain usually feels dull and constant. It becomes worse after sitting too long or lifting something heavy, but it improves with movement and light exercise. Now let's talk about nerve-related pain. Nerve pain happens when spinal discs press on nearby nerves. This can be caused by disc degeneration, herniation, or arthritis. Nerve pain feels different. It may be sharp, burning, or shooting down your leg. You may feel tingling, numbness, or weakness in one leg. This is often called sciatica. If pain travels below your knee, that is usually a nerve sign. So how can you tell the difference? If your pain improves when you stretch and strengthen your back, it is likely muscle-related. If your pain spreads, causes numbness, or feels electric, it may involve nerves. But here is the important part. Ignoring both types is a mistake. Muscle loss gets worse without activity. Nerve compression gets worse without treatment. Now what should you do? First, stay active. Gentle walking and simple core exercises can strengthen your spine support. Second, avoid long hours of sitting. Stand up and move every hour. Third, maintain healthy weight. Extra weight increases spinal pressure. Fourth, improve posture. Slouching adds stress to your lower back. If you experience severe pain, leg weakness, loss of bladder control, or constant numbness, seek medical help immediately. Do not wait. Lower back pain after 50 is common, but it is not something you should simply accept. Your body changes with age, that is normal. But pain is a signal. Listen to it early. Strong men do not ignore pain. They understand it and fix the cause. Take care of your spine, and your spine will support you for many years.